All right, I've got a story for you today that is just wow. It's pulled from a real medical case report, and it's honestly one of the most incredible tales of survival you'll ever hear. We're talking about the Gehad polytrauma case.
And really, that's what this is all about. This isn't just some dry medical document. At its heart, it is a story of survival. And I mean, survival against odds that seem, well, completely impossible. And it all kicks off with something terrifying. A fall. Not just any fall, a fall from the 7th floor. I mean, just pause and try to picture that for a moment.
So that's the scenario. The question that hits the medical team the second she comes through the doors is, what do you even do? How in the world do you save someone after something like that?
All right, let's get into the details. Section 1, the fall.
Okay, so the patient, she's just 23 years old, and before this, perfectly healthy. She hits the ER in what's called hemorrhagic shock. Now what that means, in simple terms, is she's bleeding out internally. So much so that her organs, her whole body is starting to shut down. We're talking about life hanging by a thread from the very first second she arrives.
Okay, so she's in the ER, and the clock is ticking. The trauma team's first job, figure out what's broken. They need to assess the full extent of the damage, and they need to do it like yesterday. And the damage? It was just staggering. Let's break it down. Her chest, both lungs collapsed, she's bleeding internally, and she's got a bunch of broken ribs. Her abdomen took a huge hit. We're talking a torn liver and spleen, plus a bruised kidney. And then her feet, multiple fractures in both. I mean, this was a top-to-bottom, absolutely catastrophic level of injury.
So in medicine, they have a way to sort of quantify all this chaos. They take all of these devastating injuries and boil them down to a single number. For her, that number was 41.
So what does 41 even mean? Well, it's her injury severity score, or ISS. Think of it as a scale for how bad the trauma is. Now, here's the key part. Anything over 25 is considered major trauma, with a very high risk of not making it. Her score wasn't 26, it wasn't 30, it was 41. To put it bluntly, from a purely medical, statistical standpoint, her chances were grim.
So you've got this catastrophic score, the clock is ticking. What do? The ICU team didn't hesitate. They launched into an immediate, all-out fight for every single second.
This whole process has a name: damage, control, resuscitation. And the idea is actually pretty simple, but it's genius. You don't try to fix all the broken bones at once. No, you focus only on the things that are going to kill her in the next 5 minutes. So what did they do? Number 1, get a tube in, secure her airway, let a machine breathe for her. 2, put in chest tubes to drain all the blood and air and get those lungs working again. 3, hit the big red button on the Massive Transfusion Protocol. That means you're pumping blood and plasma back into her as fast as it's leaking out. And 4, use powerful drugs, vasopressors, to just force her blood pressure to stay up.
Okay, so they managed to pull her back from the edge. They stabilized her from the initial massive trauma. But just when you think they've got a handle on it, a new enemy appears. This one's invisible. The fight was far from over. It had just changed battlegrounds.
So let's look at the timeline here. Right from day 1, they put her on broad-spectrum antibiotics. That's standard procedure, right? Try to prevent infections. But by day 7, things aren't looking right. They suspect she's developing pneumonia from the ventilator. Then, day 10, they get the lab results, and it's bad news. It's not just an infection, it's a superbug. And if that wasn't enough, 5 days later, bam! They find a second superbug, this time lurking in one of her wounds.
Now, these weren't your garden variety bacteria. You see that XDR label? That stands for extensively drug resistant. And what that means is these little guys are resistant to pretty much all the normal antibiotics you'd throw at them. Think about it. Her body is already pushed to the absolute limit. An infection you can't treat, that is a death sentence. The team had no choice but to bring out the big guns, the last resort antibiotics. Look, you don't survive a 7-story fall and then survive not 1, but 2 different superbugs because of one heroic doctor. That's just not how it works. You survive because of a team, a whole army of specialists, and that's what turned the tide.
And what a team it was. You had the obvious players, right? General surgeons, orthopedic surgeons, cardiothoracic surgeons. But it's the rest of the team that's so incredible. You had clinical pharmacy, who were basically the generals in the war against those superbugs. You had clinical nutrition, whose job was to create a diet that could literally rebuild her body from the inside out. And physiotherapy was there almost from the start, working to keep her muscles from wasting away. It was this incredible coordinated effort, a perfectly woven safety net of care.
And all of that work, all of those specialists, it all leads to this. The final chapter of her hospital stay, the long road home. And when you put the before and after side by side, it's just mind-blowing. Okay, look at day 1. She's sedated with the machine breathing for her, totally immobile. Her consciousness score is a 9 out of 15, which is not good. Now, flash forward to day 29, she is fully awake and alert, a perfect 15 out of 15. She's breathing on her own, no ventilator, and she's walking with a little help. I mean, come on. The transformation is just, it's stunning.
29 days. That's how long this battle took in the ICU. Almost an entire month of fighting for her life, not just day by day, but minute by minute. And the case report itself really nails the why. It says her survival is, and I'm quoting here, a testament to the efficacy of rapid initial resuscitation, judicious surgical decision-making, and a dedicated multidisciplinary team approach. In other words, it was the perfect storm of modern medicine working exactly as it should.
So that leaves us with one last big question to chew on. We've seen the incredible science and teamwork that it took from a medical perspective, but what does a story like this, what does her story really tell us about the limits of the human body and the human spirit to just endure? What is the absolute limit of our own resilience?